Our next question is from Working Class Man 2026. As an emergency department doctor who also sits on the Standing Committee on Health, Aged Care and Disability, what unique structural bottlenecks do you see in regional hospitals like Gosford or Wyong the federal policy is still failing to capture, and how will your committee work address them?
Yeah, absolutely. And again, we're going in for the long-winded question, but I will answer the question, I promise. So for those listening out there, I sit on the Health, Aged Care and Disability Committee. In the previous Parliament, it was the Health, Sport and Aged Care Committee. It has purview and remit and oversight of, different inquiries when it comes to those sectors of their health, disability, aged care portfolio. Over recent years, and in particular since our election in 2022, we've seen considerable investment. So I'll start with what's good, and then I'll go to sort of what we sort of need to work on and the challenges that we're still facing at the moment. So when we were elected in 22, we saw a considerable amount of people that weren't able to access primary care. There was a considerable amount of people that weren't able to either afford or who had to rationalise their medications. So basically choosing between the medications that they were prescribed based on cost and also to either going without because either rent or school fees or whatever it might be was taking precedent over that person's medication. We saw that people were waiting considerable amount of time in our emergency departments for ailments and injury and illness that didn't necessarily need to be in an emergency department, but might have been a bit too, not advanced, but a bit too acute and a bit too sort of in that emergency realm for a general practitioner or a general practice. They were some of the big challenges that we saw early on. I'm very proud of the fact that, my office had considerable input into the implementation and the creation and the establishment of urgent care in Australia. A bit of background on urgent care. So as it stands at the moment, we have urgent care clinics across the country now, and they're basically, if you're too sick for the GP and not sick enough for the emergency department, they're for adults and kids, and they're bulk billed walk-in clinics with extended operating hours. In my region, so in the Central Coast of New South Wales, we have 3 federal urgent care clinics. And what they are there for is if you're too sick for the GP, not sick enough for emergency. Now, Australia had a very ad hoc, haphazard version of that. I wouldn't say it was a model of care that existed in Australia prior to 2022. After they were stood up in 2022, it really took off. And, seeing a new model of care, which is urgent care in Australia, is something that I'm particularly proud of. But it also, too, is providing Australians with another access point for healthcare. To put this in perspective, urgent care medicine in Australia, it didn't exist before 2022. Now it does. It's kind of like saying cardiology didn't exist yesterday and now it does. It is a new model of care, a new specialist area that, we're working on implementing throughout the country. And it is, politicians say things like this on the TV all the time, but, it is making a difference. And it really is targeting those category 4 and 5 patients who are entering into the emergency departments. When you walk into ED, your triage category 1 to 5, 1 being the most life-threatening, 5 the least, really tackling that bottom end of that triage scale. And we are seeing diversion away from emergency departments towards those urgent care centres, and that leaves the EDs free to do what EDs do best. I suppose one of the challenges that we have in our emergency departments, at the moment, is we have an older population who are a lot more medically complex and who require significantly more medical resources. Gone are the days where a person would come into emergency with one issue or one concern. Now a person will come in with a multi-system problem. It might be something affecting the brain, the heart, the lungs. There might also be an injury associated with that. So there'll be a multi-system problem that requires both specialist intervention and an admission to hospital. And because of that, we are seeing high numbers in our hospitals. So that's a challenge that we face currently and will continue to face into the near future. And I think we're really going to have to, really have a good look at that and and also work with the state governments as well as to how we best address that. I suppose sort of adjacent to that issue is also to aged care and aged care beds and aged care access. There was a really striking article this morning in one of the major mastheads talking about access block in our emergency departments, and some of the root causes of what's causing that access block, and aged care bed accessibility is one of the concerns in that field. And in the Parliament recently, I'm standing up an advocacy group to make sure that is seen in the federal light, because I think that's something that we're going to need to address now and into the future in order to help ease that access block as well from the federal government perspective. But then also too, just to take it out of the hospital for a minute, one of the things, particularly on the coast in regional areas, and this is the case across the country, but it's going to be good we're formalising this process, is we're standing up an inquiry through the Health Committee with regards to specialist fees and specialist access. Because while a lot of people are doing the right thing, we know that there are some specialists that are charging quite considerable fees to access their services and to access their clinics. And I think that really needs to be assessed by the government in order to make sure that there's fair and equal access of medical services across the board. We often talk about EDs, we talk about GPs, we talk about pharmacy, but this other branch of medicine and healthcare, which is specialist health services, is something that needs to be addressed and reviewed. And that's what this that's what the Health Committee is about to embark on, an inquiry we're about to embark on. But then just sort of finishing on a more positive note, and looking at the bulk billing incentive, we're seeing an increase in bulk billing across the country now. Practices are now swapping to bulk billing as a result of the tripling of the incentive. There's now considerable incentive for general practitioners and their practices to bulk bill, and that's alongside the $25 scripts as well for medicines. Because I think, and this is one of the, I'm quite passionate on that medication access component as well, because in particular when you see people rationalising their medications, and I've seen this as a clinician, people will pick, which one's the cheapest one. I've got food to put on the table for my kids. I've got to put petrol in the car to get to work, whatever it might be. And you'll have people picking between their cholesterol medication or their antihypertensive, their blood pressure medication. And, both are risk factors for quite significant disease. And, without taking your cholesterol medication, for example, that puts you at risk of a significant cardiac event, like a heart attack. Or if your blood pressure is spiralling significantly out of control because you're not taking your medication, that can lead to problems in the brain, but also too, it can lead to chronic kidney disease and kidney failure that might see you on dialysis in the future. So I'm really passionate about that preventative access to medications, because at the end of the day, it helps general practitioners do their job as specialists in the preventative health space, but also too, it stops you from seeing me in the middle of the night, which I think is truly important.